Avacincaptad Pegol, PF, 2 mg per 0.1 ml intravitreal solution is a medication used to treat a specific serious eye condition called geographic atrophy. It can help delay vision loss by blocking the immune system from destroying cells in the eye. This medication is administered as an intravitreal solution, which means it is injected into the eye. It is important to follow your healthcare provider's instructions on the dosage and timing of this medication for the best results. Once a month, a healthcare professional will inject Avacincaptad Pegol, PF, 2 mg per 0.1 ml intravitreal solution into the affected eye after numbing it. After the injection, you will be monitored in the doctor's office. It is important to use this medication regularly and mark the days on a calendar for each injection. If your condition worsens, be sure to inform your doctor. If you experience eye irritation or swelling, it's important to let your doctor or pharmacist know. However, many people using this medication do not have serious side effects. It's been prescribed to you because your doctor has judged that the benefit to you is greater than the risk of side effects. Be sure to tell your doctor if you experience floaters, which are blurry shapes that seem to float in front of your eyes. Additionally, this medication may rarely increase your risk for developing certain serious eye conditions such as endophthalmitis or retinal detachment. If you notice symptoms such as pain, redness, sensitivity to light, or vision changes in the affected eyes, it's important to seek medical help right away. While a very serious allergic reaction to this drug is rare, it's crucial to get medical help right away if you notice any symptoms such as rash, itching/swelling, severe dizziness, or trouble breathing. If you experience any other effects not listed above, be sure to contact your doctor or pharmacist for further guidance. Before starting Avacincaptad Pegol, make sure to inform your doctor or pharmacist if you have any allergies or if you have had any previous allergic reactions to similar medications. This medication may contain inactive ingredients that could cause allergic reactions or other complications, so it's important to discuss any concerns with your pharmacist. Additionally, be sure to disclose your medical history to your doctor or pharmacist, especially if you currently have an eye infection or swelling. It's important to note that this medication may cause blurred vision, so it's recommended to avoid driving, operating machinery, or engaging in activities that require clear vision until you are sure you can do so safely. If you are planning to have surgery, it's important to inform your doctor or dentist about all the medications and products you are using, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, it's important to discuss the risks and benefits of using this medication with your doctor, and only use it if it's clearly necessary. If you are breastfeeding, consult your doctor before using this medication, as it is currently unknown if this drug passes into breast milk. When taking Avacincaptad Pegol, PF, 2 mg per 0.1 ml intravitreal solution, it's important to be aware of potential drug interactions that could affect how the medication works or increase the risk of serious side effects. It's important to keep a list of all the medications and products you use, including prescription and non-prescription drugs, as well as herbal products, and share this with your doctor and pharmacist. It's crucial to follow your doctor's guidance and not start, stop, or change the dosage of any medicines without their approval. This will help ensure the safe and effective use of Avacincaptad Pegol, PF, 2 mg per 0.1 ml intravitreal solution. If this medication is ingested, it can be dangerous. In the event of an overdose with serious symptoms like fainting or difficulty breathing, it's important to seek immediate medical attention by calling 911 or contacting a poison control center. In the U.S., residents can reach their local poison control center at 1-800-222-1222, while Canadian residents can contact a provincial poison control center. Be sure to have regular medical tests, such as eye exams, while using Avacincaptad Pegol, PF, 2 mg per 0.1 ml intravitreal solution. It's important to keep all medical appointments and consult your doctor for more details. Be sure to take each dose of Avacincaptad Pegol, PF, 2 mg per 0.1 ml intravitreal solution on time as directed by your doctor. If you happen to miss a dose, consult your doctor or pharmacist for a new dosing schedule. This medication is administered by a healthcare professional in a hospital, clinic, or doctor's office. It should not be stored at home. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.